A lot of people are asking about Demi Moore's face, or Demi Moore's face. This is America's sweetheart. She's almost 60 years old now. And as she's aging, she's taking advantage of a lot of resources that are available to us as humans now to keep her facial beauty intact. And we've got to give her credit for that. And the truth is, it's not fair or reasonable to make any assumptions about people's healthcare history or the surgery they may have had without their consent. And so I just want to preface this discussion by saying I don't know Ms. Moore, and I certainly don't want to make any claims that are suggestive of what she's had done, but I do want to clarify some myths about facial plastic surgery that have arisen as a result of her drastic change in appearance, or a drastic change that appears based on a few photos that we've seen. So first of all, what has Ms. Moore had done? None of us know. I mean, there's something called HIPAA, which is a way of protecting patients' private health information that won't allow any of us to really know what she's had done. It's none of our business, and frankly, you know, she's entitled to do whatever she wishes. But it doesn't change the fact that we are all curious, and there's a million videos and a million news articles spewing, you know, ideas and thoughts and gossip as to what she may have had done. And there seems to be a few common themes here about what she's had done, and I just want to offer my opinion of what I think may have happened. So first of all, Ms. Moore is a beautiful woman. She'll always be beautiful. And if she had facial plastic surgery, kudos to the doctor who performed it, because a lot of the issues that I see in her aging face have been rectified. But it doesn't change the fact that there are some new shadows that occur, and we can talk about maybe what those are. The reason I'm producing this video today is because I saw another video recently that said that this is a result of buccal fat pad removal. Buccal fat pad resection is a huge part of my practice. It's also known as bichectomy or buccal fat pad removal. And as you've seen a lot of videos that I've produced about this, and a lot of people have concerns about hollowness occurring as a result of removing this fat pad. In the case of Ms. Moore, it is very possible that she's had buccal fat pad at some point in her career. I found an older picture of her, and she has a lot of hollowness in front of the masseter muscle. She's got a beautiful facial contour here, but there's no question, and I don't know the age of this photo, but there's no question that this photo explains why she looks the way she does right now. In this photo, you can see two separate shadows, one emerging from the cheekbone and one coming from the lateral aspect of the lip. That is I would say, a way of predisposing yourself for either, it's called the Joker deformity or a cross-facial, cheek depression that can occur after a facelift. And it's not necessarily the result of a bad facelift, but people who are predisposed to having a pretty deep fold emerging from their ears and going to the corners of their lips can have this if the facelift is performed without really thinking about the most artistic approach to avoiding this deformity. So I can see in this picture here that Ms. Moore, if she were to have a facelift in older years, would have a pretty dark shadow emerging from her ear and going all the way to the corner of her mouth. She may have had buccal fat pad resection in her youth, or she may not have. But the result that we're seeing today is not a direct result of buccal fat pad removal. I can almost assure you of that. What we have here is a lot of fullness in two fat pads, one called the medial malar fat pad and one called the infraorbital fat pad. We've got awesome cheekbones and we've got an awesome jawline. As you've seen from previous videos of mine, these are the ingredients of a great result of buccal fat pad resection when you want a flat cheek or a slightly concave cheek. This is exactly what she has. But fast forward 10 years, thinning skin and weight loss, and it's time for a facelift. Patients with these pre-existing features, which are good for buccal fat pad resection, are also predisposing features for what we call a cross cheek depression or a Joker deformity after a facelift. And I think that's what's going on. So now, especially with the lighting of a runway show, a fashion show, you can really see this. It's really enhanced. And it may not look this way in normal life, in real life. But in that one photo that we've all seen, that's what we're looking at. Furthermore, the surgeon who performed the operation either intentionally or unintentionally did not address the fact that there is hollowing here and such a predisposition for this deformity, which is not a deformity if you want it. But that's what's going on. Then to add sugar to this, to add fire to the pot here, she also appears, in my opinion, again, just opinions, to have had a lip lift. And the early results of a lip lift not only shorten the upper lip with the intent of bringing the oral commissure higher on the lower 1/3 of your face, it gives you that pouty look, which is it's a youthful, feminine feature. It's really attractive, right? That pouty look. But when you have shadows coming down this way and an arched lip that looks pouty, it accentuates those shadows further. It's all about lighting. It's all about the balance of light and dark. Buccal fat pad alone, ladies and gentlemen, did not cause this change in Miss Moore's appearance, again, in my opinion. A facelift, without addressing a predisposition to what we call a Joker deformity, did. In addition, there's a very high possibility that fillers or fat grafting in the midface and facial threads are more visible now under her thin skin and are giving you this sort of appearance and these weird shadows that are forming. This is something that is definitely correctable with as little as 1 to 2 syringes of filler per side and or facial fat grafting, and also can be corrected with just the tincture of time. I hope you guys appreciated my opinion on this case, and this is exactly what I think. I think everything about Miss Moore is beautiful, and she will continue to age gracefully with a little bit of touch-up perhaps and a little bit of time. Thank you.